Delivering a baby is one of the most miraculous things a woman's body can do, and also one of the most painful. If you're pregnant, or if you plan to get pregnant soon, you may be wondering what actually happens to your body when you go into labour. Here's what the experts say you should be on the lookout for. Your water breaks. One of the first things that happens when you go into labour is that your water breaks. OB/GYN Dr. Sherry Ross shares that this is medically known as spontaneous rupture of membranes. Just like the other parts of the birth process are different for each woman, you will experience your water breaking differently than other women will. According to Dr. Ross, it may be a subtle leak or a big gush when your water breaks, and you may or may not have uterine contractions. But one thing is definite: early labour will begin within hours of your water breaking. No need for food. You would think that giving birth would make you ravenous. After all, your body is doing a lot of tough physical work. However, OB/GYN Dr. Stephanie Romero told Splinter that's not the case. She shared, "People get very worried about not eating while they're in labour, but you just don't get hungry, and you don't want to eat. Despite your body working so hard to push out your baby, you won't get tired either." Dr. Romero continues, "Fight or flight keeps you awake and gives you the power to keep pushing. No matter what time of day someone is in labour, whether it's 1 a.m. or 1 p.m, they are wide awake and in the moment." The contractions start. Contractions are one of the more well-known parts of the labour process. When you go into labour, your uterus contracts and starts pushing your baby out. Contractions are painful, but they're necessary to bring your baby into the world. In fact, your uterus is one large muscle. As you get closer to term, it will start to contract. These early contractions, known as Braxton Hicks contractions, aren't actually a sign of labour. Instead, they're getting your body ready for the labour that is coming in the future. Dr. Ross advises, once the uterine contractions appear closer together with increased intensity, this is a sign that labour has started. Regular and painful uterine contractions occurring every 3 to 5 minutes for 2 hours are a sign early labour has begun.
Sorry. Give me some drugs. We don't need drugs. Give me this. I want those drugs. Let it go.
Hello, back pain. While contractions are painful in and of themselves, they can also cause other pain. Dr. Ross explains, since the uterus is a large muscle, the cramping sensation of the uterus tightening mildly may be felt in the back when the contractions first begin. You may also feel back pain that's unrelated to contractions. Kay Johnson, a certified nurse midwife, told Parents magazine, "Normally, a baby descends the birth canal with its face pressed against the mum's spine. But in some cases, the baby descends with its skull hitting the mum's spine. Ouch." All about the mucus. During your pregnancy, there is a mucus plug that covers your cervix to help protect your baby from infection. But as you might imagine, a lot of bodily fluids come out of your body along with your baby, and your mucus plug is one of those. If it doesn't come out before labour, a lot of mucus will definitely come out during labour. Dr. Romero told Splinter, "Some people say they've lost their mucus plug, but in reality, there is no one real plug. It's just lots and lots of mucus in the cervix that gets discharged and discharged and discharged. It looks like you blew your nose out of your vagina."
That's terrible.
That's not all you lose. In addition to losing mucus during labour, you also lose a lot of blood. But don't worry, blood loss is perfectly normal. In fact, the body actually produces more blood during your pregnancy specifically to prepare for labour. Even after you deliver your baby, that doesn't mean the blood is over. OB/GYN Dr. Shannon Clark told Splinter, "There's a big gush of blood that goes along with the placenta being delivered, and that scares women a little bit. But as physicians, we're programmed to know what's a normal amount of blood and what looks different and needs extra attention." Second delivery. After you deliver your baby, you'll deliver your placenta as well. Then your uterus will begin to contract to its pre-pregnancy size. Even though it's painful, your uterus contracting is actually a good thing. Dr. Gaither explained, "By clamping down, it also serves to close off all those open vessels that are present after the placenta delivers." A lot of stretching. Just as your cervix changes during labour, your vagina also stretches when you give birth. If you're worried about what will happen after you give birth, rest assured that while it won't go back to being completely the same as it was, it will heal and the swelling will go down. Dr. Mary Jane Minkin told Health, This area can feel fairly uncomfortable for some time, though it does get better within a few weeks. She also shared that sitting in a warm tub can help the swelling and pain subside, and it's all worth it.